Good day, everyone. You're welcome to this episode of Podcast with Olamide. For today, we'll be discussing self-medication. But first, I need you to meet Mr. Shola. Mr. Shola is a 29 years old chemical engineer and married to a beautiful wife with 2 children. He had a previous history of abdominal pain and now has serious back pain. He discussed with a friend who suggested diclofenac, which is a non-steroidal anti-inflammatory drug. Mr. Shola decided to triple the dose for optimal action, but noticed no improvement, rather worsening of symptoms. He used the drug for a while and later discovered blood in his stool, which increased in intensity with the use of the medication. And by the time he discovered there was no improvement, he decided to seek for medical help, and he presented at a hospital where proper investigation was done and a diagnosis of peptic ulcer disease was made. But Mr. Shola never knew he had a peptic ulcer disease and that the back pain, amongst other symptoms, was only a referred pain. Can you see? Can you see the dangers of self-medication? Many people are like Mr. Shola, who in a bid to cut costs has caused more harm rather than good. That Mr. A and B has a headache doesn't mean they have the same disease or diagnosis. For an example, Mr. A has headache from malaria and treats with an anti-malaria. Mr. B also has headache and goes to Mr. A, who advised the use of an anti-malaria, not knowing that he has something more severe, maybe a brain tumor. There are numerous medical causes of headache, but you can never get to know which one it is without consulting a medical practitioner. Self-medication. Self-medication, according to the World Health Organization, is the use of drugs to treat self-diagnosed disorders or symptoms. It may include the use of herbs, the retention and reuse of prescription drugs for chronic recurrent diseases or symptoms. In our next episode, I will be sharing with you the drugs frequently abused and its effect. Stay tuned.